Hi, this is Jeff Luker from Complementary Therapies, and today I'm going to be doing a basic technique of lancing or needling a trigger point on my forearm. I've had some trouble for a while, so Chris Deary here is going to help me to locate the trigger point, and we're going to actually stick a needle in the point and deactivate the trigger.
So, first thing we'll do is, that's a sterile pack, and you do this pretty much religiously with every acupuncture session.
It's standard clean needle technique, yeah. So
Okay.
I always disinfect the area with alcohol and get it ready for the needling.
Okay, and now we'll examine and find where the trigger point is. Now, tell me where the most sensitive part is.
Right about there.
Okay. So now I'm going to go to either side. So I open it up. And just mark it. I'm not putting any more pressure in. Okay. Is this painful?
Nope, not at all.
So you just put that needle. Why are acupuncture needles not painful?
Well, they're smaller gauge than any kind of hypodermic needle, and they're also solid, unlike the things you get at a doctor's office. There's nothing.
Oh, because they're hypodermic because they're putting fluid into.
Right, and these are solid filiform needles.
Okay.
So what I'm doing now is actually just manipulating the needle to the point where I can feel the trigger point with the end of the needle.
And is that a sensitivity that's developed with education
You
and
just get a
practice?
feel for it, right?
Okay. Now, if you were doing this on a person, you would be able to tell when you got to that point?
I can feel it in the needle, and I also look for a twitch response in the muscle itself, which means the muscle's letting go whenever I hit it.
Okay. Is that painful for the client?
No.
They feel a relief, though.
They do, yeah.
Excellent.
We'll leave the needles in for 5 to 10 minutes typically for trigger point therapy.
Okay.
And I could also do several other needles too, because there's a series of trigger points here, so I might actually do 2 or 3 up and down this actual part of the muscle.
Now, is that congruent to traditional acupuncture points?
It is, yes. Traditional Chinese medicine, there's a point called an ashi point, which means that's it. And basically, if it's something sore, if there's a sore part of the body, that needs to be worked on anyway. So it's just an easy way to find points.
Okay.
Yeah.
Excellent. Well, thank you, Jeff, for showing us this. And we invite you all into Complementary Therapies to explore this. Keep your eyes on www.retulsa.net/TCM. And we look forward to seeing you. Give us a call, 918-994-2873. Have a great day. This is another perspective of isolating a trigger point and then needling it with Jeff Luker at Complementary Therapies. First thing is isolating the trigger point. Right about there?
Right.
Now,
What I'm doing now is I'm just swabbing it down with rubbing alcohol once again. Make sure the surface is clean. Now that I know exactly where the point will be, I'm going to use the guide tube and the needle here and just lightly tap it in. And I just adjust the needle until I start to get a little twitch response from the muscle fibers. And that indicates that the trigger point is starting to let go. And you usually don't have to go too deep either. It's usually just a little bit of searching here.
And that's not painful?
Nope. Can't even hardly feel it.
And how long do you let that sit in there?
Typically 5 to 10 minutes until the muscle starts to let go and relax.
Okay.
And I'll often do several points along the line there too. But for this situation, we're just going to use one needle. And I like to go back and actually stimulate the needle a little bit to make sure that everything is still working properly. Make sure it's still stimulating. There we go.
Now, do people bleed when you take the needles out?
Rarely. There's some points that you might hit a vein or a artery, but that doesn't really happen that often. And even if you do, it's just just a drop, and that's it.
And there's no, as you said before, there's no pain or discomfort.
No. Sometimes it's kind of a heavy, distending feeling, which is actually rather pleasant because you can feel the pain going away as the needle is used.
And then to follow clean needle technique, as soon as you're done with this procedure, you dispose of it in the cemetery.
Yeah. Mm-hmm. In a sharps container, and as soon as I pull the needle out, I also clean it with rubbing alcohol once again, just to make sure that everything is completely clean.
Well, thank you very much, Jeff, for showing us this. And visit www.retulsa.net or call us at 918-994-2873 and book your appointment with Jeff Luker for trigger point needling or traditional Chinese medicine. Keep on to this YouTube channel for more videos with Jeff and traditional Chinese medicine. Have a great day.